You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to PM&RRecap.com to learn more.
Can everybody see just the one slide now?
Yep.
All right, so I guess I'll start off by introducing myself. My name is Molly. Molly Andre. I'm a PGY4, one of the administrative chiefs at Penn State, and I'll go ahead and let my co-chief introduce himself as well.
Hey guys, I'm Zach Billington. I'm the other PGY4. I'm the academic chief resident. We're going to be kind of tag team in this presentation, so I will let Dr. Andre take the floor.
All right. So I'll start off by saying that we are located in Hershey, Pennsylvania. I know Penn State, our main campus, is like an hour and a half away from here, but we are located in Hershey, which is, our tagline really is the sweetest place on earth, and it really is. For those all participating in this whole virtual interview season, I think that's the one takeaway I would say you wouldn't be able to get through our virtual process, is that everybody is very, very sweet, and everyone is super nice and welcoming in this area. I know that's one of the reasons that I chose to go here. Traffic is really never an issue, so you can't use that if you're running late. And if you have family and children, it's a really great school districts in this area. Obviously, our main attraction, and everybody knows this for, is Hershey Park. It's a super fun place. I was able to actually go there this year with my niece and nephew, and they had a blast. So it's a really fun experience, and they're actually open throughout the year as well. So during even October, I think they do a Halloween thing. So Hershey's a really fun area to train. I will say that in addition to just having, lots of chocolate readily available, we also have lots of outdoor opportunities to go hiking. And there's local places to go skiing, snowboarding, things like that. I am into lots of the really awesome breweries around the area. We have some really fun wineries as well. So there really is tons to do in the Hershey area. I will say that I am from the DC area. So I will also mention that it's very centrally located. So we are in a good location in that it's not far from DC. It's not a far drive from Philadelphia, not a far drive from Baltimore. All those places are really within reason. So I think that's another benefit to living in Hershey. Not only do you have the area that you're living in, but you also have a lot of other places that are within close range for you to visit friends and family and things like that. In terms of our program leadership, so I think it's actually pretty cool. We have all female leadership. So Dr. Romanowski is our program director. Dr. Grafton is our department chair. And Michelle is our awesome, amazing, wonderful program coordinator, whom without we would be lost. She is amazing, and anything and everything you need, she is able to help out with. So we really love her. And then obviously, I am the administrative chief, and then Zach is our academic chief. So in terms of our training locations, another benefit I really liked about our program and why I chose it was we don't have to go many places. So we have our main Penn State Rehab Hospital, which is where you will do all of your inpatient rotations. And additionally, you also do all of your clinic rotations as well. And then our hospital, so our main hospital, the Penn State Hershey Medical Center, is located literally 5 minutes away from Penn State Rehab Hospital. And that's where you'll do your consult rotations, you'll do your pediatrics over there. I love going over to the med center. There's also the benefit is it is a level 1 trauma center, not just for adults, but for peds. So I think that's another additional draw. If anybody's interested in pediatric rehab, we have a really robust opportunity to see some really interesting cases that you might not see other places, because we are a level 1 trauma center for both pediatrics and adults. In addition to that, Lebanon is our VA rotation. That is a little bit further away. I would say probably about like 30 minutes away. But again, that's only during your 4th year that you have that rotation. And otherwise, you're really just bouncing back and forth between the med center and the rehab hospital, and everything else is really driving distance is like 5 or 10 minutes, 20 minutes max. So for the most part, you are pretty centrally located. Just a little bit about our PM&R residency program. We are a smaller program, so there's 4 of us per year, which is actually pretty great. I really like that about our program. It's small, you don't get lost in the mix. You really form strong relationships with everybody that you work with. Another benefit is that we actually, for your first year, you're all in the same place. This is actually our resident room in the top left corner, which is where these are some of our PGY2s currently. And you spend all of your time together, so it's really kind of cool. So all 4 of you are in the same resident room. We have our own space, which is cool because you're kind of getting used to rehab, and if you have a bad day or good day or whatever, it's just nice to have those people around you, and you get to know each other really well. Sometimes a little too well, but it's a really fun experience to all be in the same place, which I think is also something I didn't realize was important when you're training. Again, we do have a really great set of people. We all do really enjoy spending time together. And these are some of our, in the middle, some of our residents who just graduated and actually all matched into fellowship this year. So I think that's the first time that's happened for our program. We do have the opportunity for prelim spots through our IM program. So that is something that is another option for medical students to think about. The next thing I'll talk about is our rotation schedules. So for your first PGY2 year, you are all inpatient for the most part. I think that's something that's pretty great about our program, as it being a newer program, is that we actually have the option to be a little bit more flexible. So our program directors has been really great about taking our input and making changes. So you'll see that we actually have some clinic experiences here. So that's continuing to change. Having all inpatient was great, but I think having a mix is actually really beneficial. So now we've mixed in clinic. So you have spinal cord, complex care, stroke, and brain injury. Those are your main rotations, but having the mix of clinic, and now actually we have 2 months of clinic that are mixed in. So I think it's a really great opportunity for residents to just get their feet wet in clinic and see what the outpatient life is like, and give them a little bit of a break from inpatient duties, as that can be a little bit more challenging. During your PGY3 year, you actually have mostly outpatient. So I think actually, yeah, mostly outpatient. So EMG, consult, that was one of my favorites. That's over at the med center. You get to see all kinds of stuff over at the med center, lots of traumas, lots of really cool, unique things that you don't get to see over in rehab. Pain is another rotation. We get to do sports is another rotation. Pediatrics, again, that's something that used to be an area where we didn't have as much exposure, but we have 2 really amazing pediatric rehab physicians now, and it's become a very robust service. You also get more of the clinic. I will say that there is no shortage of being able to do procedures in this residency. I have gotten the opportunity to do lots of Botox, lots of ultrasound, guided injections. In pain, you get to do lots of things. In sports, you get to do lots of joint injections. So having a smaller program, I feel like I've really gotten hands-on experience with baclofen pumps, like everything that you can imagine. I feel at this point as a PGY4 pretty comfortable doing by myself. So I think that's something that's pretty unique about our residency program. You also have the option to do a 4-week elective. That's also pretty unique. And actually next, I'm going to do an elective rotation in upcoming weeks, which is pretty great. You can do it at another institution. You can do it within your institution. So that could be an away rotation for pain if you're interested in doing pain somewhere. And you want to do some sort of like an audition rotation, you can do that. Or you could do it within the institution. And then for your PGY4 year, a lot more outpatient opportunities, more clinic, another consult service. This is where you'll actually do your VA rotation at Lebanon. And that will be a mixture of some EMGs and outpatient, some prosthetics and orthotics opportunities as well with the VA. Something that's newer this year is having a little bit more of a return to inpatient. I know that myself and Zach are both interested in doing inpatient, so it's nice to kind of get a little bit of exposure back to inpatient before moving on and graduating. So I think that's a positive change that we've made for this year, and it also allows for our PGY2s to actually get a little more experience in clinic. And I will now let Zach go over some of the educational stuff.
All right. Thanks, Molly, for teeing me up. So as far as our research time, it used to be kind of month blocks, but we have changed it now to longitudinally. So throughout your clinic time, you will have half days scattered throughout your clinic time to work on a research project. You can signify a mentor, and they can help you through. We also have a chair of research, Dr. Gardner, and a quality improvement, Dr. Vitt, who work with you, present on, how to efficiently, set up a research project, how to navigate the IRB process, all of those things. And it equivalates to, I think, 40 half days throughout the residency. And you end up presenting your research on our resident research day, which last year was virtual. Sometime, I believe, it probably will be for this COVID kind of era. We also do a QI project, which is completed in teams of 4. So each year you will actually do a QI project, takes the load off of you as an individual, increases the actual productivity of the residency program by cranking out, more quality index projects and having more measures and indices. And then didactics, it's a 18-month cycle. So you will see everything kind of twice. Our didactics are Monday mornings. They're a 3-hour protected time at a separate area where there's breakfast that's served. Our wonderful coordinator, Michelle, like Molly hinted at, she makes sure we are well fed throughout the residency program. As you can see, I'm not going to kind of read through them all, but there we follow the AA PM&R kind of guidelines to build our didactic sessions. I will say we have been doing a lot more interspecialty integration. So we have what's kind of unique is a 4-week block of just anatomy, where we talk about a section of the body. We review imaging correlates with a MSK radiologist, and then we actually go into the cadaver lab. And the last week, we actually have the neurosurgery team come in and talk through the brain and spinal cord, and we look at that radiologically and then also through the cadaver lab. We have a longitudinal MSK and ultrasound course taught by our sports or MSK specialist. Other educational sessions. So monthly, we do monthly M&Ms, grand rounds, and journal club. As a PGY4, you do present a grand rounds presentation. and then, presenting journal clubs and M&Ms throughout. We have our research day, like we said. One other thing that we do unique that I like to bring up is we have a career panel where all of our previous alumni and then many other physicians in PM&R around the area actually come in, and we've been doing it virtually since COVID, and they talk with us about kind of their career path, what they do, and we're able to ask a lot of questions about, more of the business aspect or how to negotiate a contract and all of those things.
We have about 5 minutes left.
Okie doke. Our call, so our call is home call. You only take call as a PGY2 and a PGY3. PGY 4-year, you stop taking call. So Molly and I have made it. With the exception of July, we do give a month for the new PGY2s to get acquainted with the standalone rehab. It works out to about every 8 weekdays you're on call, and then every 8 weekends. So you're on pager call, you answer the page from home. If it's a non-emergent issue, do things from home. Otherwise, you'd come in. And as a resident, you only work 1 to 2 holidays your entire residency. Excellent. Here's just kind of a summary slide of our previous residents by class and kind of what they're doing. In previous classes, we haven't had, there's some residents that have just went right into general physiatry practice. Last year, I think, was the first year we had all 4 residents go to fellowship. Since the beginning of our program, I don't think we've had anyone not match into a fellowship if they wanted to. And last year, we did match 2 people into sports, which is very difficult. And we have a very close working relationship with the pain management anesthesia department. And that class of 2020, we matched 2 in there that year, and then Renuka matched in this year. Institutionally, we do have a brain injury fellowship, a spinal cord injury fellowship, and then, like I was saying, via the anesthesia department, pain management, which we get a lot of experience with the department. This is just kind of the general benefits. You can kind of read those in the sake of time. We are allowed to moonlight as a PGY4. I will add that in there. These are just pictures that show that, we like each other outside of residency as well. I'm from Montana, hence the cowboy hats in the upper right corner. And I am a black cloud, hence the all black. All of our attendings have signed a resident anti-discrimination initiative. We started it. The Penn State College of Medicine has one that we participate with, but us as a division participate in creating and fostering an inclusive, diverse environment. And actually, Dr. Andre is on that committee as well. Here's some contact info. I think the easiest way to get a hold of us is email. That's the one thing that I always check. And then we have our coordinator, Michelle. She's great with answering questions, and Dr. Romanowski.
About 2 minutes left.
All right.
I don't think I can see the chat, so I'm going to stop sharing, and that way I can actually see the chat. But
yeah, I think I just saw 2 pop up. It says, being a standalone rehab, are you limited in what imaging you can order for patients? Yes. So I would say the quick answer is yes. We have an X-ray machine. So if someone pulls an NG tube, we can replace an NG tube, chest X-ray, KUB, those types of things. If it's anything more urgent than that, usually we send them over to the emergency room to get further imaging. If everything's normal, then they come back. But as far as imaging, like CT scan, MRI, we do have an outpatient imaging clinic that's, again, over at the main campus. We schedule and we can transport patients over there. So if it's a non-urgent thing, not a big deal. If it is an urgent thing, then yes.
And I just answered, but the second question regarding pain, so we do get some exposure as a PGY2. Again, that's changed that in our program now we get outpatient experience, and we have an awesome pain trained physiatrist that you get to work with.
I see the peds. So pediatric exposure. Yeah. So we have two pediatric physiatrists, Dr. Such Nybar, who I would say is more of like the spasticity, spinal cordy kind of one. And then Dr. Wright, who's more of like the TBI, muscular dystrophy attending. You do some consults, you actually round on inpatients and do clinic. There's an MDA clinic that we work in, a spasticity clinic, and a spina bifida clinic. You get to do procedures. I actually got to scrub in with the neurosurgery team on a Van Ness rotationoplasty on a patient, which was pretty wild to see. And we also work with the neurosurgery department and get to scrub in and see some selective dorsal rhizotomies with Dr. Akbari. And then you see a lot of spasticity, and in the MDA clinic, you see a lot of genetic stuff that quite frankly, I'd never even heard of. So as far as like the peds work of it, you also interact with the peds neurologists. So you get some didactics education from them, and then also interaction with them in a clinic setting, if that answers your question.
I think that's all the time we have today. Thank you so much, Penn State, for jumping in real quick and giving an awesome presentation. Feel free to stick around and answer further questions in the chat. So let's
good luck to everybody with the interview process. We hope to see you.
Yeah. I know all the residents say it, but enjoy the process. I know it's hard to do, but you guys will be fine. All right.